Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral fully occluding earwax, and I'm just commencing with this there right here first. They advised me that they had been poking inside their ear, so they were very honest in that respect. So they were using a Q-tip, it's what we in the UK call a cotton bud. And in addition, they had been getting water in their ear, which is, again, if you follow my channel, I'm strongly against water entering the ear for several reasons, and I'll try and explain that during the course of this video. And in addition to that, they were using a hydrogen peroxide based ceremonotic, so an eardrop agent, to help soften this wax. And again, if you've been following my videos over the years, I'm not the biggest fan of hydrogen peroxide. Let me explain why I'm not a fan of hydrogen peroxide first. So hydrogen peroxide drops are water-based. They can be non-water-based. You can have them with just urea. But generally, even if they're not water-based, when hydrogen peroxide enters the ear, the hydrogen peroxide reacts with an enzyme called peroxidase, which is secreted by the ceruminous glands. So the ceruminous glands are modified sweat glands called apocrine glands that are found on the outer third of the ear. And the hydrogen peroxide reacts with the peroxidase, and then it converts into water and also oxygen. And during that transition of a fluid to gas, so the oxygen, you get effervescence, you get a bubbling mechanical motion, which is believed to help break up the earwax plugs. So if anyone have used the hydrogen peroxide based drops, you typically hear this fizzing and popping and crackling sound in the ear, and that's that reaction, hydrogen peroxide converting into water and oxygen. So what the hydrogen peroxide drops can do is make the wax plug very mushy, like this, because it's breaking up all these little skin cells. You've got water in there, so these skin cells are also hydrophilic, so they absorb the water, causing the skin cells to expand and swell and then burst, and that's why you get this mushy consistency. Of course, water increases the pH level of the inside of the ear. The ear should be mildly acidic, so when you've got increased pH of the ear, you're more likely to develop an infection, because under these mild acidic conditions, a lot of the bacteria that are native to the ear, so the skin flora, are non-pathogenic. But when the pH level increases, they can become pathogenic, and it also allows non-native bacteria to enter the ear and colonize and then lead to an infection. So I'm not a fan of hydrogen peroxide drops for that reason. And the reason why I'm not keen on water in the ear, so water, especially if it's warm water, it can leach away from the surface of the ear canal what we call essential moisturizing factors, and this is essentially sebum. So sebum is an oily lipid secretion also found on our scalp, and that's secreted by the sebaceous glands, which are located on the outer third of the ear canal, where the hair strands are. They are at the follicle of the hair strands. And as the sebum is secreted, it travels up the shaft of the hair strand to the surface of the ear canal. And you've also got serum, which is the oily sweat secreted by the ceruminous glands, which I described earlier. So this oily sweat and oily lipid secretions produced on the outer third of the ear canal, they then dissipate, they spread and line the ear canal, and it provides a moisturizing agent for the skin, so it prevents the skin from drying and cracking. It also helps the underlying skin that it's resting on to retain its natural moisture in the absence of these oils and sweats, which the leaching of them can occur by warm water in particular. Internal moisture in the skin cells rises to the surface and it evaporates. In addition, if water is in the ear for a long time, it can macerate the skin, and you can see that here, particularly at the entrance. I was worried there may be an ulceration, so the absence of skin here, but it seems okay. It's just quite macerated, but I'm just trying to peel away as much of this as possible. I just want to make sure there's no underlying ulceration or erosion of the bone, because that could potentially be a canal cholesteatoma. And I've been seeing quite a few of canal cholesteatomas of late, and they typically are hidden underneath a thick blanket of epidermis skin like this. So patient's ear was slightly tender, so it was a bit tricky. You can see that it's slightly wobbly, and it's just because the patient just finding it slightly tender. But I did explain that I just wanted to remove this just in case, especially here again. You could have an anterior canal wall ulceration, and at first appearance it did look a bit ulcerated, but it's just the skin's inflamed underneath. There's no discharge here, there's no erosion of the canal wall, just got this thick squamous layer of skin that I just want to peel away. And so with dead skin like this and lining the ear canal, if it doesn't migrate, it can release proteolytic lysosomal enzymes, and these can start ulcerating the skin. Just want to clear this up, but this patient's ear does need to dry up because it's really damp. There's also some granulation tissue, you'll see it on the eardrum. So, and we need to re-acidify this ear. So it's just, I've advised this patient to use some acetic acid, and the acidity introduced by acetic acid, which is essentially white vinegar, will help re-acidify the ear, because no doubt this ear is, the pH level is more neutral than acidic. And guys, we're not going to get every little last piece of skin here. We're just wanted to get these. It's more for diagnostic purposes. Actually, what I'm doing at the moment at the entrance, just to make sure there's nothing sinister underneath. And there's going to be a few specks here and there. When we clean the ear, it's not a car wash. We're not here to clean every little last speck. In fact, the ear needs a bit of earwax to help moisturize it, to help. The earwax itself is acidic to help repel insects, to capture any foreign particles, dust, dirt that enters the ear, and also to that's that granulation tissue. So again, this acetic acid hopefully will help with that. But if not, this patient does need to see their GP for some prescribed medication. So it just needs to recover. It's had hydrogen peroxide based drops. It's had water in there. It's had cotton bud in there. All the big no-nos for me, really. Again, here you can see the indentation made by the Q-tip. It's quite central, and it's kind of lodged this, but the patient didn't get any water in here, hadn't been using any drops, so the skin is not as tender and inflamed as their right side. Just mopping this away. There's a bit of skin there. I think the tube just got blocked. You can see that the wax at the core it's darker, it's oxidized, it's been there longer around the edges, the perimeter. It's lighter shades, so that's more freshly secreted wax and keratin that's yet to go through the full oxidization process like the core of the wax plug has. And these skin adhesions, they've enveloped the wax plug and also attached to the canal wall, so just to separate that. So it's quite a large plug there removed, and that's revealed the patient's eardrum. So the ear canal now is fully patent. There's no occlusion. There's just a bit of wax keratin just here at the entrance, just past the first bend. So we know that's the first bend there because we can see some of the hair strands protruding outwards. So it's just in between. So that's the first bend here where the hair strands are, and beyond that, to the left, you've got the second bend. So our ear canals should be S-bend. There's also known as a sigmoid shape, and it's believed to help protect the eardrum from any foreign object that may enter. I've got a really good friend who recently suffered a traumatic perforation. Their toddler, and I've mentioned this in a couple of other recent videos, inserted, unbeknown to my friend whilst he was resting, an oral thermometer into the ear, and he's got a really, really straight ear canal, and it severely ruptured his eardrum. I'm due to see him, I think, next week. Next week, to see if this is healed. Fingers crossed it has. Unfortunately for my friend, many years ago, he also suffered from a perforation in the opposite ear. That was due to barotrauma. It was water pressure when he was going scuba diving, I think it was white water rafting. A wave went into his ear, or he fell into the water. I can't remember exactly, but that ear, the perforation hasn't healed. But it's never really caused my friend an issue until I think a few years ago he did have an infection in that ear. But other than that, he's been okay. And he's very careful. He doesn't avoids water in the ear, which is even more important when you've got a middle ear infection, a perforation, and the middle ear is accessible through the eardrum. You just don't want water entering that middle ear cavity. So let's see next week. But if you had a straighter, a more bendy and twisty ear canal, it may have helped protect the eardrum from that trauma. So I guess we'll never know. So that's all the wax and skin removed from both ears. I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.